still had a undiagnosed broken skull, possibly leaking, and I needed an MRI urgently. I learned St. Vincent's East Hospital, located in Birmingham, Alabama, will only give an MRI in the emergency department if you exhibit stroke symptoms. For my complaints, was not adequate. I asked more than once, on more than one visit. I think that every hospital should invest in an MRI machine. They should make it available in place of an X-ray or CT because it shows more detail than either of those in many respects, and it's non-invasive. X-ray accumulation is not helpful in biological organisms, which people fall under that classification. Any person in this day and time and goes to hospitals, doctors, they should know this. X-rays are not good for you. If you don't understand what I'm talking about, do some research. On the other hand, MRIs are not that invasive, and I think every hospital should have an option to do an MRI in the emergency department under a wide variety of medical conditions besides this stroke symptom issue here. I had little money and tried the other Christ Health Center in Woodlawn. This place was close to downtown Birmingham. The lobby was full of immigrants where very few words of English could be heard. I'm not racist. I'm just giving an honest observation. I like people all around the world, all shapes, sizes, colors, creeds. I've traveled around the world. I wish I could travel all around the world in every country and experience different cultures. I think that's very healthy. So no, I'm not racist, but I'm stating a fact. Reiterated my injury in my neck, skull, and symptoms. I told her I didn't believe I was treated as a human being at the Springville Road Christ Health Center, and that St. Vincent's East Hospital, Ascension Health, had made an error in my diagnosis, and that I needed an MRI urgently. It appears that Christ Health Center is being used by St. Vincent's Ascension as a patient sieve. Those that present to the emergency department, for example, with no insurance, limited income, no money, no job, these people, they are filtered down to Christ Health, where they're segregated. It's like an Obamacare segregation center. So think about that for a little bit. And it looks like everybody involved is being gamed. The doctors in this place, they have no experience to speak of to do a whole lot. There's a lot of infighting apparently in these places. You can look around the internet and see that. It's like a preliminary round for some reality show. Yeah, and of course, most of the people that work in these places and are just starting out, they want to be big doctors and well-established, well-heeled hospitals and practices, things like that. So they're all too willing to acquiesce to the demands or the influence of this larger medical institution in order to gain favor and advance up the ranks of this very closed, draconian system.